Hello, hello. Well, thank you, everyone, for being here today. Mayor Bynum, thank you so much for hosting us here in Tulsa. And we've got Representative May with us, Representative Provenzano. We've got Senator Hayes. Thank you for being here. I think I've got Representative Ford with us. So thank you guys so much for your leadership, making this all possible. We're in the briefing room of the Tulsa Police Headquarters. And before we get started, I want to say that we're continuing to pray for the families of Sergeant Craig Johnson and Officer Arash Zarkashan. I know Officer Zarkashan is recovering right now, and we hope continues to go well and he gets back with his family very, very soon. We're here to celebrate how the city of Tulsa is going to use its share of the federal dollars we're awarding under the Coronavirus Relief Fund. In late March, Congress directly awarded money to the states to help with COVID-19 and also to the cities and counties with more than 500,000 people. That cutoff line left the city of Tulsa on the outside looking in. As the governor for all 4 million Oklahomans, I knew that we needed to use some of our CARES Act dollars to take care of Tulsans. We believe in local control in Oklahoma, and that our mayors, just like G.T. Bynum, and our other local officials know what's best for their communities. So that's why we decided to award $250 million to cities and counties all across the state of Oklahoma based on their population to allow those communities to directly meet the needs of their residents. Mayor Bynum and his team at the city of Tulsa have done a great job coming up with innovative ways to use this money. And I'm especially proud to hear some of these funds are going to help educate our children right here in Tulsa. At this time, on behalf of Representative Kevin Hern, Senator Inhofe, Senator James Lankford, my Cares Forward team, including proud Tulsan and Secretary of Budget Mike Mazie, I would like to present, along with my friends in the House and the Senate, a check to Mayor Bynum for, come on up here, Senator, for $30,923,815.75.
Great. Thank you.
Absolutely. Mayor Bynum, I'll turn it over to you.
Thank you so much, Governor. I'll try to fold that up and put it in my pocket on the way out. You know, I really am very grateful for Governor Stitt and his team. As he mentioned, when these funds were first released by the federal government, there were entities, over 500,000, both cities and counties, that it went directly to. And it left us in a bit of a confusing spot here in Tulsa as to where the funds that would serve Tulsans were supposed to come from. And there's been a lot of dialogue and discussion around where that should come from, but it really took Governor Stitt to get it off high center and say this money isn't supposed to be sitting in a bank account while we debate. It's supposed to be out there helping Tulsans suffering from COVID-19. So, Governor, thank you very much. We're very grateful here in Tulsa. And I want to echo the governor's thanks for our federal delegation, in particular Senator Inhofe, Senator Lankford, and Congressman Hern for their great representation of Tulsa in securing these funds for our community. With this allocation, the city of Tulsa is really looking at how we can serve our community in several key areas. The first would be addressing unbudgeted costs that were incurred due to the public health emergency. It is not without significance that we're here at Tulsa Police Department headquarters. Police services is the largest budgetary allocation for us at the city of Tulsa, and keeping Tulsans safe has been our #1 priority throughout this pandemic. regardless of the costs. And so it's great to have these funds to help us shore up those costs moving forward. Additionally, we'll be making safety modifications to public facilities. That includes protective equipment, touchless system modifications to those facilities, drinking fountains, points of entry and exit, and remote access as well. We'll also be supporting our most vulnerable Tulsans with these funds. And that includes staff to conduct outreach and connect unsheltered Tulsans to services, providing day and night shelters for social distancing, as well as protective equipment. We'll also be providing job training, facilitating remote work, and supporting entrepreneurial ventures for COVID-19 displaced workers. The Retrain Tulsa program will have an expansion of workforce development programs, career counseling and referrals, skills training, extended technical training, and a number of other things. The big one, though, that we're very excited about and we want to announce today is around internet access. We recognized in the early going of this pandemic, as schools shifted to virtual education, that it was so important that we make sure that families throughout our community have access to the internet so that children could participate in that. And so in April of this year, the city of Tulsa began working with about 24 different agencies, but led by Tulsa Public Schools, Jenks Public Schools, and Union Public Schools, and Impact Tulsa to launch the Internet Access Task Force. It's a task force that has been focused on identifying the needs and building upon the work of school districts to find solutions that will ensure Tulsa students and their families have internet access and can be successful. Very importantly, this was a data-driven initiative. The task force identified several key data points that have driven their recommendations in this space. Number one, 15% of Tulsa County families have no internet access at home through any means. 1 in 3 Tulsa households don't have wireline broadband that's needed for virtual meetings or online learning. That's 1 in 3 households in our community. It's estimated that nearly 57,000 households in the city of Tulsa and 20,000 Tulsa students do not have fast, reliable internet at home. And so thanks to the partnership with Governor Stitt and the state of Oklahoma's allocation of coronavirus relief funds, the city of Tulsa is going to utilize $5.6 million to provide internet access to more than 22,000 families in our city. And that funding is going to be focused in 3 primary areas. $2.7 million of it will provide high-speed, reliable Wi-Fi to all Tulsa Housing Authority residents. That'll impact nearly 2,500 families and more than 8,000 Tulsans. And that is in partnership with Cox Communications, and we will provide free internet for the next 3 years for those families. $2.4 million will provide high-speed internet coverage for up to 20,000 public school families that currently lack an internet subscription. This funding will provide free internet for families for the next year. And $500,000 will fund internet access navigators through our Tulsa Responds and Tulsa's powerful network of nonprofit organizations, ensuring that families know about the subscription opportunities that are funded through this program and have access to them. So again, on behalf of the citizens of Tulsa, I am very grateful for the governor's action in this regard and doing what is necessary as we start this school year to make sure that Tulsa families, and in particular our youngest Tulsans, have access to the technology they need to get a great education. And so, speaking of people who are great proponents of a great education for all Tulsa kids, it's my honor to introduce the Superintendent of Tulsa Public Schools, Dr. Deborah Gist.
Good afternoon, everyone. Governor, thank you for this investment. It is so incredibly important. I'm grateful to these state leaders who are here to help make this big announcement. Particularly want to call out Representative Provenzano, a former team member in Tulsa Public Schools and a tireless advocate for public education. We're grateful for her leadership in education and beyond. This is incredible news. We know that the digital divide is an issue that is not new to this pandemic. But like many other inequities and injustices that are a part of our society, this pandemic has uncovered and made this situation much more evident to all. And we're glad that we have come together to put solutions in place that will be lasting. So we've been working for months now to get plans underway that will be short-term fixes, and then working with the mayor's leadership and that of his team on the Internet Task Force to make sure that there are also longer-term solutions that are in place, including those that the mayor just gave you details about right now. We've been working with our families. We've had team members making phone calls to thousands of our families to check in with them and see how they're doing and see what kinds of supports they need, and specifically to ask them about their internet access. And we know that we have at least 10,000 families who either don't have or have unreliable or inadequate internet access. And this affects not only their children's learning, both when we're in school, certainly if we're on distance learning, but it also is a barrier to families because of the numbers of jobs and other resources and educational opportunities that are available for adults online as well. It's really a critical utility for families to have these days. But we know that it's not only internet access, it's also devices and having that laptop to be able to access the internet. So we are so grateful to Tulsans because for more than 25 years, Tulsans have supported the bonds that we asked them to approve. And as a result of that, we are a one-to-one district and have been able to provide devices to families. But the other thing that we have to do is then help our families know how to use these resources. They have the device, they have the internet access, and we need to make sure that they also have the ability to use them successfully. And so we've been checking in with families. We have a team that's working on family support, educational experiences for families to get to know the materials. But we've also made sure that the way in which students connect with our learning platform is super simple. They'll just flash a badge, it will sign them in automatically, and they'll immediately have access to all the tools that they need to have a successful day of learning. Again, both when we're on distance learning, but also when we're back in our schools full time, which we hope to be very soon. Lastly, I just want to make sure that everyone knows that we were so excited yesterday to launch, along with the Tulsa Area United Way and the Opportunity Project, a portal for families for all kinds of services and ways to solve problems, just like these resources that the governor and the mayor are announcing today, but also for ways to connect them with safe and educationally supportive childcare opportunities during this distance learning time. So it's covidkidcareresources.tauw.org. That's Tulsa Area United Way. And that's a great place for families to go to find additional help. So it's my honor to introduce you to an amazing woman who is a tireless advocate for children and for families. And she is the executive director of Impact Tulsa, an organization that brings Tulsans from all across the county and the area together to support children and families. My friend, the amazing Carlisha Williams Bradley.
Thank you, Dr. Gist. I would like to thank Mayor Bynum and Governor Stitt for this opportunity to really invest in education and access for our students. Impact Tulsa is proud to partner with the City of Tulsa for the Internet Access Task Force. I'm truly grateful for the leadership of Dr. Dalia Kimbrell. She's Impact Tulsa's Director of Research and Analytics. She's been an instrumental leader and relentless advocate for this effort to eliminate barriers to access. The Impact Tulsa team has served as data experts, conveners, facilitators, and true individuals who are engaging the community in this effort for the task force. A core principle in our collective impact work is the goal of transforming systems for more equitable outcomes. This task force is a reflection of the power of data-driven problem solving and cross-sector partnerships leading to systems change. The digital divide is one of the many inequities that has been exacerbated in the midst of COVID-19. 15% of Tulsa County families, as Mayor Bynum said, do not have access to the internet. And when we think of Tulsa's lowest income residents, those making less than $20,000 per year, 33% of families lack internet subscription access. Additionally, as our Impact Tulsa team dove deep into the data, we saw clear geographic and racial disparities in access as well. Therefore, the work of the Internet Task Force has been critical in ensuring that students in Tulsa will have the resources that they need to engage in schools in the new climate. As more and more schools shift to distance learning models for the fall to ensure the safety of students, the work of the task force is helping families to be fully prepared and closing the gap for the most vulnerable populations. This effort took into account both quantitative and qualitative data points, while hearing the lived experiences of community members lacking access, which even challenged the working group's assumptions as they began to solve for underlying problems as well. An example of the power of this process and the community-driven approach is the Internet Navigators program. Internet navigators working through community organizations across multiple languages will work with and actively reach out to populations identified through data-driven research to reach the most vulnerable population, and those for whom primary spoken language, documentation status, financial burden, or other hardships might have previously prevented them from obtaining an at-home internet subscription. The Navigators program, coupled with greatly expanded options for public Wi-Fi at places like multifamily complexes, local post-secondary institutions, and local libraries, is making it easier than ever for families to access high-quality educational opportunities here in Tulsa. In closing, I appreciate my Impact Tulsa colleagues, the City of Tulsa, our school district partners, community partners, and businesses that have given their time, effort, support, and innovative ideas to work towards solutions. The road ahead will require us all to re-envision the ways we have approached our work and partnerships. But the silver lining is an opportunity to rebuild systems that are equitable and that harness the power of cross-sector collaboration with aligned resources, just like we're doing here today. As I think about this work and the power of collaboration, I'm reminded of a quote by Dina Simmons. She said, "On some level, COVID-19 is our equity check, reminding us of who we could be if we valued equity as much as we say we do. Let's not wait until the next pandemic to get it right. If we do, the ones who will suffer will be the ones who always suffer, the people most in need. This novel virus is a wake-up call, an opportunity for us to all come together to do better and to be better for every single child." Thank you again for this opportunity, and I'll turn it back over to Governor Stitt.
Thank you so much, Carlicia. Appreciate that. And Dr. Gist, thank you. We're also here to announce some additional guidance for Oklahomans as we continue our fight against COVID-19. We're almost 4 months into our reopening, and we've been fully reopened for a little over 2.5 months now. We're seeing some really positive trends. Our 7-day average of new cases is down 39% since August 1st. And it's its lowest level it's been in 3 weeks, 672 as of today on a 7-day average. I believe that in-person learning is essential for our children and our families. And I've heard from so many Oklahomans who feel the same way. We have had hundreds and hundreds of calls to the governor's office from single moms and single dads who say, "Governor, I've got 2 children and I work full time. They've been at daycare. They've been at the YMCA all summer long. We can't. They're either going to be home or they're going to be back in daycare in the fall. Please open up schools." I dropped my 2 children off at school today for their first day of school. As schools are reopening all across the state of Oklahoma, I'm calling on Oklahomans to do their part to stand with us over the next few weeks and follow Dr. Fry's recommendations. We all want to get life back to normal. We all want to keep this positive momentum. So I'd like to turn it over now to Commissioner of Health, Dr. Lance Fry, to give us an update on some new recommendations. Dr. Fry?
Thank you, Governor. Good afternoon. It feels good to be back in Tulsa. Got to sleep in my my own bed last night, which was great. Oklahomans have worked aggressively to combat COVID-19 by taking both personal and social responsibility of their actions. And we're really encouraged to see how our case numbers continue to trend down, and our hospitalizations are trending down as well. But I want to caution everyone that it's not time to ease up on our recommendations and our efforts. We must continue to be aggressive in the steps we're taking to slow the spread of the virus. Our goal has been and will continue to be keeping Oklahomans healthy and preventing deaths. Since reopening our economy, Oklahoma has strengthened its fight against COVID-19 by increasing its testing capacity, growing our contact tracing, and updating our hospital surge plan. While we're encouraged by the decreases in cases and hospitalizations, rest assured, we are not slowing our efforts. The State Department of Health has worked closely with Oklahoma State Department of Education and school leaders such as Superintendent Gist on guidelines and resources to keep teachers and students healthy. The good news is the power to slow the virus is within our control. If we use common sense and simple actions such as wearing face masks, social distancing, and frequent hand washing, we can decrease viral spread, keep our schools and economy open, and keep Oklahomans safe and healthy. Today, I'm issuing a public health advisory, Safer in Oklahoma, calling on all Oklahomans to strengthen our commitment in combating COVID-19. Through this advisory, we are reinforcing our public health precautions, including continuing to increase state testing capacity in order to perform more tests and to have all test results with a turnaround time of 48 to 78 hours. We have a public health network that we use, our public lab network that we've developed in Oklahoma. And with those labs, if you use those, you should be able to get quicker turnaround times as mentioned. The Oklahoma State Department of Health will continue to develop its data collection system to better deliver advanced analytics and to strengthen the state's management of COVID-19. And if a county is in red or orange under our Oklahoma COVID-19 alert system, it is recommended individuals ages 11 and older wear face coverings over their nose and mouth in all public places. All restaurant staff wear a face covering over the nose and mouth, and restaurants in these counties maintain 6 feet of distance between groups seated at different tables. It is recommended visitors to nursing homes, long-term care facilities, retirement homes, medical facilities, prisons, and other communal living facilities statewide in all counties to wear face coverings over their nose and mouth. We also recommend that all long-term care facilities test all staff on a weekly basis. It's also recommended Safer in Oklahoma policy, a recommended Safer in Oklahoma policy that when entering Oklahoma from an area with substantial community spread to wear face covering over the nose and mouth when in public spaces and follow the CDC guidelines for traveling from high-risk areas. The full Safer in Oklahoma advisory will be available today at coronavirus.health.ok.gov. I continue to be proud of Oklahoma's response, but we want to remind everyone that the pandemic is not over yet, and we must continue to take action and work together in order to support and protect each other. Thank you for your time.
Last week you mentioned at a Tulsa City Council meeting trouble you were having getting nutrition funding. So I'm wondering, with this CARES Act funding, after the internet connectivity stuff, are there still areas that are going to be outstanding financially?
There are many areas that are outstanding financially for many different parts of our community, but the school district specifically. And one of those areas is related to child nutrition. And in some cases, it's just a matter of breaking through the bureaucracy and getting approval for some of the waivers that we need to be able to offer the food in the way that we need it. And it's also about the way in which the administrative costs are calculated per meals that we serve children. And so those are definitely some areas of need, and I'm grateful for our congressional delegation, Senator Langford's team in particular, who've been advocating for that at the federal level, because it's a USDA issue that we need to work through. But I'll also say that in terms of the second round of stimulus, I'm sure everyone in this room is aware that we have a couple of bills that are out and in play in Congress right now, and they've been caught in partisan bickering. And the people who get lost in that are families, small businesses, and children. And right now, there's funding that is desperately needed in education. We want to be back, and we will be back in school in person as soon as we can. But to really do that safely and to make up for the other parts of this situation that we're in right now, we're going to need additional support to make that happen, particularly here in Oklahoma, where we have underfunded public education for decades now. We have right now a public health crisis. We have right now an economic crisis that's going to affect our schools for a long time in Oklahoma. We have school funding that is based on one-time funds that is going to leave our governor and other state leaders with a massive challenge to be able to keep the budget together and support schools in the next few years. We also have a mental health crisis, and the senator has been a big advocate of mental health. We have a massive mental health crisis right now for children and for adults. And then, of course, we have an education crisis. We're going to have a lot of catching up to do to support our students and get them where they need to be. And so this second round of stimulus is something that we need all Oklahomans really making sure that our representatives in Washington, D.C. know that we expect for the grown-ups to get down to business, sit down at the table, solve their differences, and get a second round of stimulus out to be able to support these really very real challenges that we have in our communities and in our schools.
Dr. Giss, while you're up there, how would someone sign up for the internet access? You're about to start school in a matter of weeks. How do I get my access so I can get plugged in and go?
Well, right now we have on our website a place for parents to go. It's our back to school registration. And if they go there, there's a specific question that asks them about their internet access and whether or not they need support with that. We've also been calling families. So we've called, as I said, more than 10,000 families that we've actually reached, and to talk to them and make sure that we understand. So we're determining who needs our help. And then we have right now about 12,000 hotspots that we're going to be distributing, starting with certain areas of priority. And at the same time, then these resources that the governor is here to present, that we've been able to put together through the Internet Task Force that the mayor has led, now gives us the chance to do other kinds of connectivity. The hotspots are more of a short-term kind of solution. And so the navigators that Carlisha described are people who will help walk our families through the process of getting the connection is available, so now we just have to help our families make the connection. So they can go to tulsaschools.org.
I haven't looked specifically at Tulsa County's I've given you statewide numbers, so I think Oklahomans are doing a great job, and I think a lot of people are wearing masks. And specifically, if the drop has been in Tulsa, then absolutely.
Sorry, I meant just all the cities in the state that have done mask mandates. Do you credit them for the 40% or 39% drop?
I would have to dig into the data, but absolutely, all that stuff goes into the reason that we're seeing a drop across the state: the social distancing, the working from home, the just Oklahomans being cautious with how we're fist bumping and staying socially distanced. I think all that goes into effect. The cleaning. I toured a school out in Hennessy, Oklahoma. They started their first week of school, and after the kids leave the classroom, they're fogging and spraying in the classroom. They're wearing masks. They have temperature checks as you're walking through the hallways that are identifying all the kids. I was in a first grade class, and they were working on their S's that day. It was really neat to see. But all those things that businesses, our communities are doing, absolutely are being affected and being effective, and you're seeing that. We're 2.5 months fully reopened. Like I said, 4 months into our reopening plan, and you saw a plateau, and now you actually saw it come down. We saw some of the cases come down. The other thing we track really, really closely is hospitalizations. Hospitalizations back on March 30th were 560. 560 people across the state of Oklahoma, and the epidemiologists at that point were predicting about 5,000 people would be in the hospitals in April, and we issued 30 different executive orders. That's when we slowed everything down and went to takeout only and all the different things that we did across the state. And yesterday we had 519 people in the hospital. So that is, we're bumping between 500 to 650, something like that. It may have been 2 days ago we had 519. So it kind of fluctuates between 500 to 650 in the hospital with the capacity that we've built. So Oklahomans are doing a great job. All the efforts that we're doing, I think, are making a big impact.
Governor, when I asked you last week about CARES Act funding, you said the $1.2 billion, you still had plenty of it. I know you hate one-time funds when it comes to the state budget. Are you holding on to some of that, anticipating filling a revenue hole?
Yeah, I don't remember saying I had plenty of it because 250 just went out to all the cities and counties. We have $100 million to backfill to make sure we don't run out of unemployment numbers, and so we've got $100 million there to backfill. We've got $100 million. I've got John Budd in the back of the room, probably can give me the exact numbers. But no, we've done a fantastic job of getting that out to our communities, to our small businesses. We set $150 million up as a business relief program. That got out the door. And so the $1.2 billion is done, except for a few reserves for counties, cities, for state agencies to continue to reimburse our state agencies also, which was a primary focus of this, for any COVID-related expenses. So as far as the different projects we have, we set up a bipartisan legislative CARES Forward team to review all the different projects. And I believe, and John Budd can correct me, but I think we've got those all identified now to get out the door.
Governor, those White House coronavirus task force reports that were coming in weekly that you wrote the chair yesterday about, I know the Tulsa Health Department and Mayor Bynum have previously expressed concern that you were getting those and not sharing them with the localities because they have specific recommendations for specific counties. So I guess the question is, are you sharing those? Are they still coming in? Are you sharing those?
We'd have to have Dr. Fry answer that, but I've been, my directive to the health department is to post everything, be as transparent with the data, so every single day we have cases, hospitalizations, everything posted on a daily basis. So if there's not anything being shared, we absolutely will share anything. If it is something coming from the White House, and you've got it as media, I would assume that everybody in the state would have it as well. So if there's anything that we need, you can contact Dr. Fry, and we'll be happy to get it out. Can't speak to why if somebody didn't have it.
On the task force note, do you have an itinerary for Dr. Burks yet on Sunday? Is she coming here?
Yeah, Dr. Fry, we're excited to have her in Oklahoma. She'll be here sometime between 12 and 4, and we're going to have her in Tulsa, looking at one of our surge hospitals and meeting with, I believe, Mayor Bynum will be there. We've invited Mayor Holt. We've invited the speaker, the pro tem. Obviously, Dr. Fry will be leading the discussion from the State Health Department, and our secretary, a couple of secretaries will be there as well. Dr. Moe from Oklahoma State Health Department, or Oklahoma State Hospital, will be there, and Elizabeth Pollard, our Secretary of Science and Innovation, will be there with us, and then a few elected other officials.
Yeah, those are not mandates. We're giving guidance and recommendations to people based off of the basically the incidence of disease in their areas. So just based off of the map, we're giving general guidance and recommendations, and these are not new recommendations. I mean, we've been saying this all along. We're just doing it in a more formal manner where they can look it up and see. We'll actually have an advisory tagged along with that.
Colonel Fry, some doctors I've spoken to here say that the red criterion for the alert system is an extremely high bar because you could have a county, say Tulsa County, everyone had coronavirus, but capacity was still fine statewide. It wouldn't go red. Is that something that you agree with or concerned about?
I do agree with it, and it was done that way intentionally. So we modeled after the White House recommendations, and they use a three-tiered system, three-colored system. So we added a fourth. So our orange is their red, and the red was really just a alarm for me if anybody was in that red space that it's actions that I have to take. I need to help them with transferring patients to other areas. I need to get them PPE. I need to increase ICU capacity or ventilator numbers. And it was really just a call to action for us to really step up. And we watch these daily, but that would be where we really have to do something. We worked with the hospitals, the Oklahoma Hospital Association, and all the regional CEOs to modify our surge plan because we realize that they are the experts at managing hospital capacity, ICU capacity. They have partnerships where they are used to transferring patients back and forth, and this is what they really wanted as well. So we work together with all that to allow that system to work as it was designed, and that's just really an alarm call to action for us to do something more than that.
Mr. Governor, I'm looking around the room. I think everyone in here is wearing a mask, and everyone on stage is wearing a mask, but you are not. Why do you choose not to wear it?
Well, because I'm up and back and forth at the microphone, but I wore a mask when I came in. I actually wore a union mask, and so I'll put the mask on when I walk off the stage. Thank you.
Hey, Michelle, can we get a picture of this deal? Governor, you mind taking a picture of the group?
Governor, can I go? I mean, Mayor, can I go with you when you cash that?
Yeah, we'll co-sign the back, right?